Hi, this is John Cullen. Welcome to another episode of Just the Facts. In this episode, I'm going to share with you some new information that I found at the CDC's website. And I'm going to show you how I was able to get the information, where I got the information. And I want you to watch over my shoulder as I show you why I believe this may be the most important discovery that I've made since figuring out that there were actually two pandemics happening at the same time, two different viruses. And why is this data the most important discovery? And I'm going to show you that in this episode. For those of you who are not familiar with my work, my name is John Cullen, and I was one of the members of the original team that built the ESRI ArcInfo system over 30 years ago. So the system that Johns Hopkins has been using to map the pandemic is based on software that I helped develop over 30 years ago. What I noticed about a year ago is that Beijing, China, did not have 10 people dead from coronavirus. I also reported that Shanghai did not have 10 people dead from coronavirus. I reported that Hong Kong doesn't have 250 people dead from coronavirus. And this is the sort of information that's coming from Johns Hopkins, so this is indisputable. This is this is the source, right? This is Johns Hopkins. And according to Johns Hopkins, there's 210 people dead in Hong Kong as of May the 5th, 2021. So not only China, though, we go to Taiwan. Taiwan only has 12 people dead, and there's 24.5 million people in Taiwan. And the phenomenon continues throughout the region. When we go to Vietnam, there's only 35 people dead in Vietnam. But the population of Vietnam is greater than Germany, greater than France. In fact, there's more people in Vietnam than any country in Western Europe. And that's how I began my research about a year ago, was realizing that even in countries like Thailand, there's still not 500 people dead. Now, Thailand's having a rough go of it right now, as is Cambodia. Cambodia is 110 people dead now. They had no one dead for quite the time. Laos still has no one dead. Myanmar, 3,209. Now, to put that in perspective, New Mexico has more than Burma, Myanmar. But Burma has about 50 million people. Kansas has more people dead. Nevada has more people dead than either Myanmar or China. Arkansas has more people dead. So it was this realization, data-based, that Connecticut has more people dead than China? How is this possible? Connecticut has over 8,000 people dead. China doesn't even have 5,000. If we look at Alabama, Alabama is approaching 11,000 people dead. But when I go to Japan, Japan has fewer people dead than Alabama. Japan has fewer people dead than Tennessee. All right, so Japan has 10,500 people dead. Tennessee has 12,200. How is it that North Carolina, Indiana, Arizona, Massachusetts all have more people dead than Japan? How do you explain that? And Illinois has more than twice as many people dead as Japan. All of Japan. The entire country. Now, if we go to Africa, the most populated country in Africa is Nigeria. Populated country in Africa is Nigeria, with over 200 million people. And Nigeria only has 165,000 cases and just a little bit over 2,000 people dead. Not even 2,100. To find that few in the United States, we have to go to states like Utah. Okay, so Utah has more people dead than Nigeria, and Nigeria has 200 million people, more than 200 million. Nebraska has more dead. Puerto Rico has more dead. Oregon and Rhode Island. So little Rhode Island has more people dead than the entire country of Nigeria. But Nigeria has over 200 million people. So my background in mapping helped me understand something wasn't adding up here. This didn't make a whole lot of sense, right? For something that we were calling the China virus for so long, shouldn't there be more than 10 people dead in Shanghai? I mean, I don't know. So I went to the CDC's website, and going to the CDC's website, I found some very interesting information. Let me show you what I found and why I think it's so pivotal. We're at the Center for Disease Control and Prevention, CDC, National Center for Health Statistics. This is the official website in the United States for tracking coronavirus. And you can see weekly updates by select demographic and geographic characteristics. And I've been using this official data now for some time. And what I stumbled across the last couple days, one of the links here focuses on a different set of data. Now, we've been looking at deaths by age, deaths by sex, deaths by race. We've been looking at depletion of susceptibles. But the big break that we had here on this channel had to do with comorbidities. Right, so the big break was that the number one comorbidity with more than 50% of the people dying with COVID was influenza pneumonia, PNI. And we broke that, I don't know, about a year ago, right? It's already May 2021. If I didn't break it in May, I guess I broke it in June, but I'll have to go back and check. What we're looking at now is the section on the CDC site that talks about comorbidities and other conditions. And the table of data below, let me read this to you. Comorbidities and other conditions. Table 3 shows the types of health conditions and contributing causes mentioned in conjunction with deaths involving coronavirus disease, 2019, COVID-19. The number of deaths that mention one or more of the conditions indicated is shown for all deaths involving COVID-19 and by age groups. For over 5% of these deaths, COVID-19 was the only cause mentioned on the death certificate. For deaths with conditions or causes in addition to COVID-19, on average, there were 4 additional conditions or causes per death. For data on deaths involving COVID-19 by time period, jurisdiction, and other health conditions, click here to download. Now, this data was updated May 2nd, 2021. And again, I'm on the official CDC website here. So let's scroll back down. Place of death, comorbidities. So what I'm going to do is I'm going to click here to download this data. And I want to work with this data upon downloading it. So first I'm going to hit the download button. It's going to take me to another page at the CDC. And we are here. So this is data.cdc.gov. Real official. Conditions contributing to deaths involving coronavirus disease 2019 by age group and state, United States. This data set shows health conditions and contributing causes mentioned in conjunction with deaths involving coronavirus disease, COVID-19. Updated May 6th, 2021. Data provided by the National Center for Health Statistics. Now, what's interesting is this data set has been downloaded 53,200 times. Who the hell was looking at it and not reporting on it? So who's downloading it and not talking about it? I don't know. Let's download it. So I hit export. I'm going to hit CSV for Excel. And I'm going to ask it to open it with the cheap numbers software it comes with. All right, so this is the data that I just downloaded from CDC. This is the spreadsheet. And what we're going to do now is take a closer look at this. I'm going to show you why I'm so excited about this data. These are conditions contributing to deaths involving coronavirus disease. And it's fresh, it's new, it's data as of 5/2/2021. But if we go out here to the right, and we look at, all right, so what's it showing us? It's showing us the various different conditions. We've talked about how influenza and pneumonia is number 1, chronic lower respiratory diseases. It says adult respiratory distress syndrome, and there's a number of medical professionals, RNs, doctors, MDs that watch this show and comment who have said it's acute respiratory distress syndrome, not adult. So I don't know why they have it mislabeled here at the CDC's database, but it's acute respiratory distress syndrome, not adult. Respiratory failure, other diseases of the respiratory system. But what you see is right next to these things, there's the death codes. Hypertension, ischemic heart disease, cardiac arrest, cerebrovascular diseases, heart failure, other diseases of the circulatory system. And then next to it, you have the death code. So sepsis is A40 or A41. Malignant neoplasms, which are various cancers, are C00 to C97. Malignant neoplasms. Diabetes is either E10, 11, 12, 13, or 14. So these are the death codes. So this is pretty official. This is pretty specific. Here's obesity, and there are a number of different types of codes for obesity, E65, 66, 67, and 68. And then Alzheimer's is G30. Right, so for those of you who are in the medical profession and who have coded death certificates, you know these are the codes. Now we go up here to influenza and pneumonia, J09 to J18. This is the P&I code. So this is really specific. And when we go out to the right, now we have by age group. Okay, so they're showing us the age group, and this should say 85 and older. So this is bad data design. 85 and older is what it should say. All right. They have not stated they have 5. Okay, this is useless. So I'm going to hide that row just because 5 is insignificant. And then they give us the total. All right, and now I'm going to push all this stuff down because I don't really need it right now. All right, so this is what we're working with at the moment. And it's really just this top area that I want to focus on. So let me zoom in so that you guys can see this a little better. Okay. So this just came right from the CDC just now. All right, so what we're looking at are these death codes, J09 to J18, and by age group. So from newborns to 24 years old, there are 377 deaths with COVID in the United States. Now, number of mentions refers to the P&I, the influenza and pneumonia. So number of mentions would be P&I deaths, right? So if this is COVID deaths, number of mentions, right now we're just talking about P&I. We're not talking about all the other stuff. So I'm going to change this to say P&I deaths because we're not looking at diabetes and all that stuff right now. All right, so next to each other, now we have side by side. Okay, all right, so by age group, 0 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64, 65 to 74, 75 to 84, 85 and older, and then that's everybody, all ages. Okay, so this is the data as we just downloaded it from the CDC. I relabeled this column heading because we're not going to be looking at all the Alzheimer's and the diabetes and all that stuff. And then this column that says flag, I don't really need that, so we'll hide that one. Okay, so what I want to do now is chart this stuff. Let's do that. So the first thing I do in this numbers program is I go up here and I click on this little chart thing and I tell it I want to make a certain type of chart. Do I want to make a pie chart? No. This one I want to make one of these. And then it wants the data. So I want to chart P&I deaths versus COVID deaths. But I don't include the total because I want to do it by age group. Okay, and that's it. Now, we should be good. Done. And let's see what that looks like. There we go. So the blue are our COVID deaths. The green are our P&I deaths. So now I'm going to format this chart a little bit to make it a little bit easier to view, a little easier to see. Okay, so this is how I do it. Now, consider this sort of a lesson in Apple numbers, okay? If you click on the chart anywhere, you're going to see sort of this 3D rotator thing. And with the 3D rotator thing, you can kind of give yourself some perspective here, all right? So the next thing I typically do is I click on this little paintbrush up here, and I make the chart deeper using chart depth. I slide the chart depth slider, and I make it a little deeper. Okay, now in doing that, now the legend is not in a good spot, so I move the legend over here by clicking and dragging it. Now down on the x-axis, these dates, that's wrong. That's not what that's supposed to say. So I click on that, and up here on the right in the format area, it says label references. I select them all, hit backspace, go over to the chart, and this is what they should say. It's the age groups, right? There we go. And now I click the green arrow, go back over, and it's starting to look better. All right, now I'm going to zoom out a little, and you start to see what the chart's looking like. The vertical axis, the numbers don't have commas, 1,000 separators. All right, and the other issue that we have here is it doesn't list all the age categories across the bottom. So in order to get it to do that, I'm going to click on the bottom, and instead of auto fit, I'm going to say show all. And now we have all of those age categories. I can now turn off the format. One other thing I do like to do with the chart, I like to set the between sets to something over 100% to separate the categories, right? Or I guess they call them the sets. All right, so now we have this chart. Now, what I often do when I create these and I share them with you guys is I add a title to the chart. And what I do to get the title is I go back to the website, right? And whatever it said for that data set is what I type in. So let's go back to the browser and see what we were calling this data set. Conditions contributing to deaths involving coronavirus disease by age. Okay, by age group for the United States. We're not breaking it down by state right now. So I copy that, and now I go back to the spreadsheet. I select the title, and I paste that in. Conditions contributing to deaths involving coronavirus disease 2019. I think we just get rid of that. Leave COVID-19 is good. By age group. And then we say when it was updated. Updated May 5th, 2021. I'll then put in the source. And the source is going to be the link from the website with the where we just were. And I paste that in there. And that's pretty much it. And that's how I set up these charts that I share with you guys. Now, so I'm downloading the data straight from the CDC. And then this is what I create. Now, let's see what we see when we look at this chart. What do we notice when we look at this? Anything? What's jumping out at you guys? I'll tell you what's jumping out of me. In every single age group category, P&I deaths are mentioned on more death certificates than coronavirus. All right, let me repeat that. In every single age group category, P&I deaths outnumber COVID deaths, according to the CDC's most recent data, in every age group. It's not that apparent until you chart it. When you're looking at the data table like this, the way they present it to you, it's not that apparent. When you chart it, it becomes apparent. That's why I chart it. All right, so what you're looking at is the United States, categorically by age group, who or how many death certificates mentioned each of these viruses. And I'm just charting what we just downloaded from the CDC. I don't know anything more than that. But we've got each one of the age groups, and then the numbers are coming right from their data table. COVID deaths, P&I deaths, influenza and pneumonia. And the reason it's so important is because they're giving you the ICD-10 code. They're giving you the death code. And that means it's really specific. This is coming from a death certificate. And they've been counted. And so of all the people that died with coronavirus, it seems more people died with P&I. It's just kind of weird. I'm not sure how to explain this, but I thought that this was a rather important revelation. And this data can be found right here at the CDC's website. Conditions contributing to deaths involving coronavirus disease. So, the challenge that I'm having now is how do we, how do you cross-foot what we're seeing here and these numbers with what we've been shown from the CDC regarding influenza burden for the past year, where the number was 22,000. So how do we reconcile that? All right, so we go back to the spreadsheets, and according to the CDC, right, we just downloaded this. We just built this together. We just did this. This is not a screenshot. This is live. All right, we just made this.
Because of what we're doing with coronavirus, we haven't heard a lot about the seasonal flu. We lose 30 to 60,000 people from the flu. Has that gone down dramatically?
Extraordinarily dramatically, Brett. And in fact, that is a very good testimony to the efficacy of wearing masks, avoiding congregate settings, and keeping distance, because we did that during this late fall, early winter. And the level of influenza in the community is remarkably low regarding comparisons to other years. Our Australian colleagues, we don't have hardly any flu this year, and we think it's due to the fact that people are wearing masks, keeping their distance, and avoiding congregate settings. Goes to show you that those types of public health measures actually work.
This is their data. I didn't monkey with it. I didn't even add it up. All I did was chart it. Right, so P&I deaths at 261,000. 261,961 mentions on the death certificates versus COVID, 257,000. So how is influenza mentioned more in every single age group category? The P&I number is bigger. That's a fact, Jack. I'm John Cullen. Thanks for joining Just the Facts.